Good morning, everybody. I am Dr. Ranga Rao, medical oncologist, presently at BLK Super Specialty Hospital, dealing with all kinds of cancers. Just for information, that the cancer, which was thought that it was a disease only of the rich and the affluent, and that too from the West, has become a very common disease in our country, especially in a developing country like India. And the incidence has been very fast. It's rising with a very rapid pace, and with which none of us are able to cope. Not only the doctors, the whole government, the population. Earlier, we were having the cancer in some people, very rarely we were diagnosing it. Today, it is that every family will have somebody or the other either dying or having treatment for cancer in the friends or relative in the near circle, so it's become so common. We are in a curve which is going up, which will remain at a plateau and then come down. So we are just in the ascending part of the curve. So we have a long way to go. And the Western people, having conquered the plateau, now they're coming on to the decreasing deaths from the cancer. Let's see what cancers are common in India. There is a difference in the cancers which are happening in this part of the world and in the rest of the world, very different. In the woman, number one cancer in India is cancer of the cervix. That is the cancer cervix, a small portion of the uterus which is below the uterus, and then it is simply because of one virus called human papillomavirus and the many factors which are responsible. That's number one cancer. The incidence of this cancer is decreasing over the years. Earlier it was very high, and now because of the changing family trends, less people are having less number of children, most of the people having less number of children, so the incidence of cancer is decreasing. And then the breast cancer is the next, and breast cancer incidence is alarmingly increasing. We have almost 1.5 lakh new patients every year, which is a huge number, which is alarming. There are different things which are happening in the breast cancer in India. Number one, that we are having young ladies suffering from breast cancer. Unmarried young ladies with different lifestyles are suddenly having the breast cancers, which has been a shocking thing to see, and it is of late increasing a lot. That's one. Second thing is the patterns are changing. The patterns are changing. The hormone refractory, the hormone sensitive patients and non-hormone responsive patients, I think the whole pattern is changing. It's a little complicated for us to understand why it is changing. The third thing is, earlier the patients used to come in very advanced disease, 4 centimeters, 5 centimeters, 6 centimeters. Even still some of the patients come in 10 centimeter breast tumor. And breast is not a thing that lady would ignore. They would be keeping it under the clothes for a long time for fear of shy. They're afraid that it may cancer. They will come to know. And also the social stigma. A daughter is getting married, a son is getting married, or some social issues. If they come to know they have a cancer in the family will be ostracized and things like that. So a lot of social issues are there, because of which the ladies are not coming forward with the complaints. I think that all people should talk to each other, examine if there's any problem, come out with these things. It's not easy to break this, so it's important for us to diagnose them very early. The other important thing is, are we geared to face this challenge of rising cancers? What are the problems which are going to be? People will die young. A lot of people will die of cancers because they come in very advanced stages. And then the cost of cancer treatment is very high. And because of lack of awareness amongst the people, and even lack of facilities in certain places in the country, because they're remote, they may not have enough facilities, and also lack of understanding about the cancer in some kind of doctors who have not been exposed to cancers. All these factors, they lead to one thing, a very late diagnosis of cancer. One, and then therefore we miss that bus, or we miss that window to cure the patients, and then they can't be cured. So they will be spending a lot of money and yet land up into a big frustrating thing that we spend everything and nothing has happened. So what is the whole solution to this? The solution cannot happen in one day. It cannot happen in a fortnight. It cannot be done in 1 year. The most important thing is the whole society, the whole population, and the doctors as well must understand one thing clearly: the cancer incidence is rising. It is controllable, it is preventable, it is possible to diagnose early. So that's the only way the West has won the war, partly. Nobody can say they have won the war in cancer subtype, but it's not like that. A lot of patients are being treated, a lot of patients are being cured in the West, simply because they come very early in the stages. Their level of consciousness, level of awareness is very high, unlike in India. So number one, let's understand that the cancer is controllable and preventable. So let's start making our lifestyles in such a healthy fashion that cancer can be controlled. So cancer, is it curable? It is very much curable. It's curable in around 70% of all cancers in the West. In India, the percentage is about 30%. The reason? Simple. We have 70% of cancers presenting in advanced stages. The West has 30% in the advanced stages. A huge difference. They have all the resources at their disposal, the money enough, and the facilities to treat the cancers. We have limited resources, we have limited facilities. So 70 versus 35, a huge difference. So half the cancers are curable less than half the cancers are curable in India, more than half the cancers are curable in the West. But still, if you do an early diagnosis, if you do a prompt treatment, if you do the right treatment, it is not necessary that all treatments have to be expensive. We can choose the generic medicines. We can use the simplest of the tests instead of going for the sophisticated tests, cut down the cost, give the same kind of treatment to these patients. So every patient we cannot cure, but at least let us give them comfort, let them live longer, let them live with a better quality of life. So that's what it is. So we should actually, so early patients, early stages of cancers are curable. Advanced stages of cancers, we should not give up. Today, we have many medicines which can prolong their life, something like diabetes and blood pressure. We can keep on giving them medicines and then they can live longer and comfortably.